Hi, my name is Phil Zeltzman. I'm a surgeon in Pennsylvania, and what follows is information about the surgeries I perform on dogs. So you received this because you're going to have me do surgery on your dog. The goal here is to explain to you how to reach success and happiness. And that requires following very specific rules. There's no question that the rules are tough, but they're tough for a reason. And I want to make sure you understand that what follows is what I do for my patients and my clients. So if you're not going to have surgery with me, please be sure to follow the advice from your surgeon. So in most cases, your dog will receive a sedative and an anti-nausea medication and a pain medication before surgery, and that'll be dispensed through your family vet. Typically, there's no food after 8 p.m. the night before surgery. Water, however, is okay until you leave in the morning. That's really important because we don't want your dog to be dehydrated, especially under anesthesia. Once you drop off your dog, it's important for you to bring all of the medications he or she is on, as well as all of the supplements. We especially need to know if your dog is on an anti-inflammatory drug, because that is one that is that we cannot mix and match. We have to stay with the same drug. We also would like you to drop off some food, 2 meals typically. Hopefully your dog will eat in the hospital so that we can continue with the exact same diet. In the vast majority of cases, your dog will be under anesthesia. We take that extremely seriously. Your dog will be monitored by a veterinary nurse whose only job is to make sure your dog is safe. So we monitor a number of vitals, just like in people, EKG, oxygen, CO2, temperature, blood pressure, heart rate, respiration rate, and a bunch of other things, because it's all about safety. After surgery, we will recover your dog, make sure we have comfort and warmth. And then as soon as your dog is awake, the nurse will call you to reassure you that everything went well. We do a lot to make sure your dog is comfortable, and in many different ways. And that's before, during, and after surgery. So we provide oral medications, and you're going to be most likely part of that before surgery. Then we give drugs, pain medications IV. We most of the time include pain medications directly in the IV fluids so that your dog gets literally a little bit of pain medications at every drop. If we do joint surgery, and even in other cases, we will inject pain medications directly into the area before surgery. In most cases, we will inject a pain medication that stays on board for 3 days that numbs the whole surgery area. And again, especially with joint surgery, we inject some pain medication directly into the site as well. So that's 6 different things we can do to help with comfort. At home, again, most of the cases we dispense 1, sometimes 2 pain medications. We usually dispense an anti-inflammatory drug. In cases where we do joint surgery, we will provide some arthritis supplements. So that's why it's important for us to know what your dog already is on, and we may stay the same, or we may recommend something that we feel is better. Your dog will typically also go home with antibiotics. We'll provide some IV, and then you'll take over with antibiotics by mouth. And in some cases, mostly at your request, we will dispense a mild tranquilizer or sedative, not to make a dog a zombie, but just to take the edge off. You'll get 2 calls after surgery, as I said, one from the nurse to reassure you that everything went well, And then typically in the evening when I'm done with everybody, I will call you myself to go over more information I wanted to share about the surgery. Like I said, we may dispense some arthritis supplements or joint supplements. Most of the time, your dog will stay overnight. And whether that happens or not, especially if it doesn't happen, your dog will experience something called dysphoria. And that essentially means that your dog is going to cry endlessly in some cases, in many cases. And this is very common after anesthesia. We expect it. It's similar to what happens to people. You may have seen these funny videos of people who've had dental work or surgery, and when they wake up from anesthesia, they say all kinds of funny things, and usually they have no clue they're saying them and they don't remember them. So the equivalent in dogs is that they cry. They don't know what else to express their stress or the fact that they're not happy, or they don't understand what's going on. It's important for you to understand that 99% of the time it is not pain, and it will stop eventually. Your dog is simply completely discombobulated and will eventually come out of it. At home, that's when healing starts. And to put it very simply, you need to treat your dog like crystal. So there's only two secrets for this surgery to work. Only two things are allowed. One is to confine your dog indoors and to control the activity outdoors. So we're going to go over both. At home, you need to keep your dog in a small area. So that can be literally anything that works at home. So it can be a laundry room, the dining room, an office, a bathroom, a walk-in closet, a sunroom, a mudroom, literally anything that's easy and convenient, so that we can keep your dog confined, yet providing an area to walk around so it's not too small. You could block off a room with baby gates. That's perfectly fine. I tend to prefer doors, but some dogs don't like doors. I'm okay with baby gates as long as you make sure your dog does not jump over the gate. I've had clients stack up 2 gates to make sure their dog doesn't jump over one. I'm okay with whatever works. Again, keep it safe. Things that are a big no-no include the family room because there's furniture, a bedroom because there's a bed, or the TV room because there's also couches and sofas your dog can jump on. And I hear all the time that clients' dogs are well behaved and they never go on furniture. Well, that may be true, but your dog may also never have been confined for 3 or 4 or 6 or 8 weeks. And as he or she gets bored to tears, they may do things they've never done before. And it only takes one jump, potentially one fall, to cause a whole lot of damage. Now, just because your dog is confined doesn't mean that you can't hang out. And in fact, I would encourage you to spend as much time as you can with your dog. So things you normally would never do in the bathroom or in the laundry room, I would encourage you to do it throughout the recovery. So that includes working, studying, reading, napping, playing games, calling people, texting people, emailing people, or just hanging out. Grab a good book or watch a video and spend as much time as you can with your dog, and it'll make for a much smoother recovery for everybody. The floor, in most cases, should be non-slippery. You can use something as simple as a yoga mat, as long as your dog doesn't eat it. You can also use the cheapest piece of carpet you can find at your favorite store. The reason I say cheap is because it might be filthy after a month or two, especially since you need to feed your dog in there and provide water. Especially if it rains or if it snows, it might become the flooring might become filthy. If that's the case, then you'll have no second thought about throwing the carpet away. As far as crates are concerned, I don't like crates in general for big dogs. So that's why I prefer a room. So there is enough room for a bed, food, water, and as I said, an area to walk around. If it's a small dog, it also should be livable. So a small dog should be in a very large crate. A terrier should be in a crate the size of a German Shepherd or a Great Dane, again, because there should be a bed and food and water and an area to walk around. Now, please keep understand, this is a general video that pertains to all of my patients. So depending on the situation, I typically will recommend 75% of the normal amount of food because your dog will be less active and will burn fewer calories. So it only makes sense to decrease the amount of food so your dog doesn't gain weight. In some cases, we'll recommend special food. So that can be for a number of reasons. It can be because of severe arthritis. It can be for weight loss. It can be to prevent bladder stones, and so on and so forth. In some cases, there will be a splint or a bandage. We will provide some instructions about that. And in some cases, when we do joint surgery or some fractures, we will provide information about physical therapy. If we take a biopsy or we send out a culture, I typically will call you within 7 to 10 days whenever the results are back. Now, let's talk about outside activity. That always should be on a leash. Doesn't matter how well trained your dog is, please never take a chance. And it should be limited to 5 minutes at a time. However, that can be as many times as needed. So 3, 5, 7 times a day. It all depends on what your dog typically does or your dog needs. Now, there is a bunch of big no-nos, okay? Playing, running, hanging out with other dogs, hiking. I don't even know what this dog is doing. I guess flying is not allowed. Squirrels, frisbees, swimming, cats, all of these things should never happen during the entire recovery. Steps are typically a big no-no, especially a big flight of stairs. If you have, so ideally the room where you can find your dog should be on the first floor if at all possible. Now, if you have a few steps on your deck, then you can use what's called a sling or a towel under your dog's belly just to go down and then back up the steps. Or if your dog is light enough and you're able to, you can carry your dog just to be safe. Oops, I'm sorry. Now, most patients will go home with a plastic cone, also called an e-collar, around the head, around the neck. That is really important to prevent licking of the incision. Dogs will instinctively lick incisions, and that can cause some serious damage. It could cause an infection. It can cause opening up of the incision, which might require another surgery and another anesthesia and more money, and ironically, another cone to protect the new suture line. So the cone really is your best friend. It prevents all kinds of problems, and it's just not worth it. There's a few patients who will not go home with a cone. For example, if we do surgery on the neck or inside the mouth, then we can't use a cone. So we'll talk about other things we can do. Now, suture removal is a sort of a generic term, and that's the only thing that exists in a computer when you call your vet to request suture removal. But you need to understand, you need to be in charge, and it means different things. So this is a typical incision with a few staples. In many cases, we will cover the incision with a Band-Aid. It is certainly not to replace the cone. It's simply to protect the incision from the environment. So we hope that your pet would leave the hospital with it as long as it sticks. And then we would hope for you to keep it on for 5 days. After 5 days, you can peel it off gently. The difficulty is that it's human grade and it does not stick to canine skin very well, even if we shave it. So sometimes it just doesn't stick well. If you notice that it's soaked with bleeding or discharge, then take it off, because the incision should be clean and dry at all times. Also, if you notice that it's a third off or halfway off, it's useless. You might as well take it off. Now, to be more specific, the generic suture removal will be at 14 or 21 days. It all depends on the surgery. Now, most of the time we use staples, so it's really a staple removal. Occasionally it's a suture removal, and in some cases it's a suture recheck, meaning there's nothing to remove. The stitches we use are within the skin or below the skin, or even if they're external, they will fall off and they do not need to be removed. And we'll talk about this specifically because it depends on each type of surgery. So we'll go over that very clearly with you. Follow-ups will be with your family vet, and that could be a number of things. It all depends on the surgery. It could be a simple exam, it could be x-rays, it could be blood work, it could be to check the range of motion and make sure you're doing a good job with the physical therapy. Again, it all depends. Again, in most cases, we will do some form of rehab once the recovery is over, the healing is over. And that is extremely simple. You'll simply put your dog on a leash and walk longer and longer and longer. So we will explain that by phone, and then we will send you a handout through your vet typically, so you can follow along and cross things off. So that's how we do things in this practice. If you have questions, please write them down. I will absolutely call you before surgery so we can chat, and I can answer all your questions. I am providing some links so you can read more information about e-collars, arthritis, and physical therapy. I'll also would include the exact same links directly below this video, so you can easily click on the information or click on the link instead of retyping the whole thing. Thank you very much. I appreciate your trust, and I will talk to you very soon. Thank you. Bye-bye.